Hello again, Chris Garden here with our next segment for Mindful Movements. Today we're going to talk about sciatic pain. Ever have sciatic pain?
I have.
How old are you?
35.
Oh. So some fun facts about sciatic. Number one, there's two sciatic nerves. And they both come out of right about here, right in the pelvis or the sacrum. Number two, fun fact, it is the largest nerve in the body. Three, it's not very fun. The sciatic nerve typically travels from the buttock or the rear end, down the back of the leg, into the back of the calf, and into the foot. So people who have suffered with sciatic pain, it's not a lot of fun. Some typical causes of sciatic issues can be an array of degenerative changes that take place. So we can have bony degeneration, arthritis, vertebral stenosis, injury. What's also interesting is that the majority of sciatic conditions happen not in the 30s, but actually the 40s and 50s. But a good fact that's interesting is that I believe 80 to 90% of sciatic conditions will relieve themselves without surgical intervention. So the biggest thing that we really need to do is take our time. This will go away. I know it's difficult for us to be patient when we're in pain. Some common symptoms that we can experience when we have sciatic pain is a severe pain in the upper back. The biggest thing is a lot of people talk to me is it's explained as a real severe deep toothache like pain that goes into the low back, the buttock, into the leg, into the foot. It affects them when they walk. It's difficult standing, sitting. It's very difficult for patients who have sciatic to sleep at night because of the nature of the pain and discomfort. So one of the things we're going to do right now is we're going to show you a couple different movements that we can do that, if done repetitively during this process, we can help relieve the sciatic pain situation that takes place. So this first one, I'm going to have Michael help me out here, and we're actually going to sit in this chair, and it's called a sciatic nerve floss. Now, typically what happens with sciatic pain is that the sciatic nerve is actually compressed by the muscle in the rear end or the buttock. So what you're going to do is you're going to bend forward and bring the head down, but I'm going to actually have your arms to your side. So bring your chin to your chest. And then what I want you to do is raise your, so the sciatic pain is going to be in his right side. Bring that all the way to the top as you can. And then you're going to relax it, come down. And then you're going to bring this back up to release it. Now, the reason we're going to do that is that there's something called the meningeal system, and the spinal cord is surrounded by it. And what happens over the course of time, there's tension that takes place. So what this is going to do is it's going to stretch and relax repetitively. So we're going to do this a few times. So bring the chin to the chest, raise the right leg as far as you can, and then relax. And then come on up, sit up nice and tall, stretch it out the opposite way. We're going to do it again. So bring the chin to the chest, bring the leg up, hold it, 1001, 1002, and relax. If we can do this repetitively when we have a flare-up of sciatic, it's going to be extremely beneficial. The next stretch that we're going to do to help with sciatic pain is I'm going to have you get down on all fours. It's a yoga pose, but it is called cat-cow. So, and what we're going to do here is bring your hands out a couple inches more. Perfect. And what you're going to do is you're going to, there you go. Bring your belly down. We're going to hold it for a count of 1001, 1002, 1003. Then we're going to bring it up. Hold for a count of 1001, 1002, 1003. We're going to do it again. We're going to repeat this 2 to 3 times. Bring it back up. Now this helps stretch the muscles associated with compressing the nerve and can help contribute to relief. The next stretch that we're going to do is I'm going to have you go ahead and get on your back. Bring your feet towards me. Now, one of the things that this is also called the piriformis stretch. And piriformis syndrome is a syndrome that I failed to mention when I was talking about some causes earlier. But sometimes that piriformis muscle moves and traps that muscle and causes that severe pain and discomfort. So what we're going to do is we're going to bring this up, bring it right there, fold that out. Yep. You're going to grab right here, and then you're going to pull towards you. You're going to hold. You feel how tight that is? You're going to hold for 1001, 1002, 1003, 1004, 1005, and then bring it back down. Now, when I do these stretches, I think it's important that even though you may have pain in the right side, that we also want to stretch the opposite side. So, perfect. Just bring it up. 1001, 1002, 1003, 1004, 1005. We want to try to keep things as balanced as we possibly can. The next stretch that we're going to do is called another yoga pose, but it's going to be the half cobra pose. So I'm going to have you flip around on your belly. And instead of doing a full, you're just going to come partially up. Because pain is so significant for most people, this may be a good starting point for you. And what we're going to do is when you come up and you arch, you're going to hold for 1001, 1002, 1003, and then go back down. Again, we're going to repeat this 2 to 3 times. Now, there is a fifth stretch, but it's the full cobra pose. And in this pose, you're actually going to extend your arms a little further, pushing yourself up. Now, for some, this may be just not something that you're going to be able to go ahead and perform. So if you can, great. If you cannot, then do the half. And again, we're going to go ahead and come on all the way up. You're going to hold for 1001, 1002, 1003, 1004. Excellent. So we just discussed an array of fun facts, symptoms, causes, and then solutions for people who have problems with sciatic. Whether you have sciatic or concerns for some low back situations, these are like a couple different things that you can do. Prevention is key in most cases. My name is Chris Garden. This is an episode of Mindful Movements, and we're covering sciatic issues. Thank you.